This week, the Ontario government is holding public hearings into Bill 27, which they'd like to pass into law. It is the Working for Workers Act 2021, and Schedule 6 of that bill would take money that was set aside for injured and ill workers, workers' compensation money, and give that money to employers. And I have concerns with that. I applied to be one of the speakers for the public hearings. They're holding 9 hours, and they have 3 speakers per hour, so that's 27 speakers. I didn't make the cut, but I did write a written submission and have sent that in to the Standing Committee on Social Policy, and here it is. Submission to the Standing Committee on Social Policy regarding Bill 27, the Working for Workers Act 2021, regarding Schedule 6, the Workplace Safety and Insurance Act 1997, the distribution of Workplace Safety and Insurance Board Insurance Fund surplus. The impact on my father, Jim Hobbs, a hardworking man who developed the occupational disease Parkinson's because of McIntyre powder aluminum dust that he was forced to inhale at work as a mandatory industrial medical treatment. Background. Please refer to the background information already provided by the following groups during the August 2021 consultation submissions on WSIB Fund Surplus Distribution Model, the Injured Workers Community Legal Clinic, the Ontario Federation of Labour, and the Ontario Network of Injured Workers Groups, ONIWIG. Please also refer to the submissions of the United Steelworkers District 6 and the Occupational Disease Reform Alliance, ODRA, to the Standing Committee on Social Policy in regard to Bill 27, the Working for Workers Act 2021. Summary of my concerns. Schedule 6 of Bill 27 does not serve or support workers. It removes funds that are set aside to ensure that workers who are injured on the job or made ill by toxic workplace exposures have access to financial benefits and supports, and instead gives those funds back to some of the very employers whose workplaces caused the workers' injuries and illnesses. This results in suffering for workers and families that is fully avoidable. The Ontario government's stated purpose of Schedule 6 of Bill 27 is to, quote, allow surpluses in the Workplace Safety and Insurance Board's insurance fund to be distributed over certain levels to businesses, helping them cope with the impacts of COVID-19, end quote. I do not object to the need to help businesses impacted by COVID-19, but I vehemently object to taking funds that are set aside to compensate and support workers for their work-related injuries and occupational diseases, and instead using those funds for the purpose of assisting businesses to cope with the impacts of COVID-19. It is akin to using Ontario Student Assistance Program, OSAP funds, to help parents cope with the impacts of COVID-19 and leaving their student children without post-secondary funds to support their education. Workers in Ontario experience workplace-related illnesses and injuries at exponentially higher levels than what are currently being recognized by the Ontario Workplace Safety and Insurance Board, the WSIB. And there is a demonstrated need to reform the WSIB. The existing surplus of employer-contributed WSIB funds was created because of the failure of the Ontario WSIB over many years to recognize the existence and extent of occupational diseases suffered by Ontario workers and the denial of claims and benefits to injured and ill workers, their widows, widowers, and dependent children. Given the well-documented under-recognition of occupational diseases by the Ontario WSIB, coupled with the reduction of benefits and denial of claims to injured workers that created the current WSIB fund surplus, the most responsible and appropriate course of action is to amend Schedule 6 of Bill 27 to direct all employer-contributed WSIB funds, surplus or otherwise, to support Ontario workers who suffer workplace injuries or occupational disease, their widows, widowers, and dependent children. Failure to do so will cause undue suffering and losses to Ontario workers and their families, as it did to mine. The human cost of failing to recognize occupational diseases. I am the daughter of good parents, Jim and Elaine Hobbs, who worked hard their whole lives to support their 4 children. Dad was raised in poverty on a farm in his hometown of Massey, Ontario. His first experience with the Ontario Workers' Compensation System came in 1955 when he was 15 years old, and his father suffered a career-ending workplace injury to his back. Dad was the eldest boy of 11 children and after my grandfather's workplace accident, Dad and two of his brothers did all of the chores on the family farm while keeping up their school studies. By the following year, at age 16, Dad quit school at his mother's request to find work to support his parents and brothers and sisters. At age 19, Dad began work as an underground miner in the Sudbury nickel and copper mines. He left mining for 12 years after his first child was born because he wanted to come home safe for his child. But as his family grew to 4 children, he returned to mining in order to support them and, most importantly to him, to give them the chance at an education and life that he never had the opportunity to pursue. In 1978, Dad started working at the Elliott Lake uranium mines at Rio Algoma Quirk 2. During 1978 and 1979, he and his co-workers were locked in a room every work shift by their employer and exposed to non-consensual aluminum dust inhalation treatments on the unproven theory, since disproven, that inhaling aluminum would prevent the lung disease silicosis. Canisters of finely ground aluminum dust, known as McIntyre powder, were punctured and attached to compressed air lines that blew a cloud of aluminum dust into the sealed, unventilated room. In 1990, Dad left mining when the Elliott Lake uranium mines closed down. He worked as a construction laborer until 2000, when early symptoms of Parkinson's disease, that he was later diagnosed with, made it impossible for him to continue work. In September 2011, after learning about Dad's McIntyre powder exposure, I became his worker representative on a WSIB claim for Parkinson's related to his McIntyre powder exposure. His claim was denied by WSIB under an occupational disease policy that WSIB created in 1997 in direct response to a worker's successful appeal at the Workers' Compensation Appeals Tribunal for a neurological condition related to occupational aluminum exposure. That WSIB policy is the only negative entitlement policy that WSIB established in its 108-year history. The WSIB did not review the scientific evidence of the health effects of aluminum for 19 years after establishing that policy, and only did so in 2016 in response to media pressure about Dad's case. In 2014, I began researching the history of McIntyre powder through archival records of the Ontario government, the McIntyre Research Foundation, and the Ontario Mining Association. In 2015, I established the McIntyre Powder Project to document health issues in McIntyre powder exposed miners and to advocate for formal research into its health effects. The McIntyre Powder Aluminum Prophylaxis Program was developed and controlled by the Northern Ontario mining industry with the sanctioning of the Ontario government and the involvement of the Ontario Workers' Compensation Board, as a means of offloading the mining industry's liability for silicosis compensation costs. For a detailed history of McIntyre powder aluminum prophylaxis, its impact on Dad's health and life, the efforts made by the McIntyre Powder Project to determine its health effects, and roadblocks presented by the Ontario WSIB system in recognizing the health impacts of McIntyre powder exposure on Ontario miners, please read Trading One Risk for Another, Consequences of the Unauthenticated Treatment and Prevention of Silicosis in Ontario Miners in the McIntyre Powder Aluminum Inhalation Program, included separately as Appendix A. In 2020, the Occupational Cancer Research Centre, the OCRC, completed a study that found a statistically significant link between McIntyre powder exposure and Parkinson's risk. As a result of that study, on October 28, 2020, the Ontario WSIB approved Dad's claim for Parkinson's 9 years later on the basis of his McIntyre powder exposure and granted him healthcare benefits for his Parkinson's-related needs. Dad died 3 years earlier on May 24, 2017. Those WSIB healthcare benefits, supports, and funding would have enabled Dad to die at home and to spend his final days near his wife of over 55 years. That did not happen. Instead, as Parkinson's took hold of Dad, it left him vulnerable and compromised and left us scrambling to meet his ever-increasing needs. Dad had a very independent mind in a very physically dependent body. He was up multiple times each night and needed 24-hour care that rapidly became unsustainable and unsafe. In the absence of financial and practical supports that would have been available to him had the WSIB accepted his claim prior to his death. In April 2017, Dad was hospitalized, and when he returned home, his legs were no longer able to support his own weight, even with assistance to stand. The last several weeks of Dad's life were very traumatic for him and for my family. There were many indignities and losses that are hard to reconcile and even harder to talk about, especially because they are so far removed from who Jim Hobbs was in life. He was hardworking, strong, fiercely independent, a provider, a protector, and we couldn't protect him or provide for him at the time when he needed us most. All of our love and efforts weren't enough. He needed more help than we could give him, and the WSIB denied him that help. Dad spent a total of 9 days in 2 nursing homes before he died. He spent 3 days in a respite bed in a temporary nursing home, and later 6 days in a permanent nursing home placement. The 3 days that he spent in the respite bed were supposed to be part of a 3-week placement, but we took him home after 3 days because 2 orderlies had left Dad alone and helpless on the floor of his room. When the orderlies caught sight of my mom and sister coming down the hallway to visit Dad, the orderlies ran back into the room and helped Dad off the floor and back into bed. Dad could not walk or stand on his own, and they left him there on that floor. When I present my McIntyre Powder Project work to people who are in positions of power to make changes, industry and government leaders, the feedback I receive is twofold. Number 1, we didn't know. And number 2, things are much better now. When I present my McIntyre Powder Project work to workers and families, the feedback I receive is also twofold. Number 1, everybody knew. And number 2, things are still bad. Workers are still getting hurt. Workers are still getting sick. They are dying, and they and the families that they leave behind are still being denied compensation. I am intimately acquainted with how power and control works. I am fully aware that this is a majority government and that if you choose to do so, you can enact Schedule 6 of Bill 27 into law. But what you cannot do is to claim that you did not know that such a decision will harm workers and families of this province. That is the purpose of this submission to the Standing Committee on Social Policy, to ensure that each of you understands the gravity and the impacts that such a decision will have on workers and families like mine. McIntyre Powder was the cause of my father's Parkinson's, but it wasn't McIntyre Powder that put him on the floor of that nursing home. It was the decisions of businessmen and government leaders that put my dad on that floor. I am asking you not to leave him there, lying alone on that floor. I am asking you not to turn your back on him and walk out of that room like those orderlies did. If you proceed with Schedule 6 and take away the money that could have allowed my father to die at home with dignity, then you are leaving my dad on that floor and thousands of others like him. You have an opportunity to ensure that there are sufficient funds available to help the present and future workers of Ontario who are harmed by their workplaces. You did not put my dad on that nursing home floor, but I will hold you accountable if you leave him there.